used properly, there is potentially a tremendous amount of benefit from radiation treatment. It's an important part of many of our treatment paradigms across a variety of cancers. Many times it's not nearly as bad as what they're thinking, or sometimes it's not bad at all. It helps to get all the information before you make a decision, I think. My name is Benjamin Gielda, and I am a board-certified radiation oncologist working in the Department of Radiation Oncology. When I was growing up, I lived all over the country, but my family always was here, so we were always visiting Michigan. So even though we'd be moving here and there, Michigan always felt like home. I completed my medical degree at the University of Michigan. Initially started practicing medicine down at Rush University Medical Center in Chicago, and the last place I was before moving here was at Munson Medical Center in Traverse City. My job is to evaluate patients, usually who have cancer, but also some conditions that aren't cancerous. Evaluate them for whether or not it's appropriate to recommend radiation therapy to them. The patient and I engage in a lengthy discussion as to whether or not it's something that they really want to do, because at the end of the day, the patient is the boss, and we're a team, and ultimately we come to a treatment plan that works best for the patient, that the patient's comfortable with. I directly oversee all of their treatment planning, figuring out how to hit the targets that we want to hit with radiation while sparing all of the normal tissues as much as we possibly can. There is a great deal of contact with the patients. You really get to know them and to take care of them, and you follow them over long periods of time. I think that a lot of people don't realize that, and that was one of the most important things to me. I'm there through the approval process, and then I directly oversee the delivery of that radiation. I meet with them while they're on treatment, and then after all treatment is complete, I follow them in follow-up. I work very closely with many different physicians in other disciplines to try to provide the best, most cohesive multidisciplinary care that we can. We treat a variety of cancers here at Lakeland. I mean, we treat essentially the whole gamut. Things like prostate cancer, breast cancer, lung cancer, esophageal cancer, rectal cancer, and a lot of skin cancer. Those are all things that we see on a regular basis. I have been published in a number of different cancer sites: breast cancer, lung cancer, gynecologic cancer, prostate cancer. My strongest research interests are in breast and lung, head and neck and prostate. I like caring for people. I like knowing that, or feeling like what I'm doing every day is worthwhile. And I think that's the best part. It's rewarding to provide something for people that's very important to their care. It can have such a great impact on their lives, but also providing them with a sort of nurturing environment from a psychological standpoint. I love my job.